Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Pregabalin. Its brand name is Lyrica. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Pregabalin is a GABA analog that strongly binds to the alpha-2 delta site in connective tissues. This site is a subunit of voltage-gated calcium channels. Although the exact mechanism of action is not completely understood, we do know that pregabalin reduces the calcium-dependent release of pro-nociceptive neurotransmitters. It may also react with descending noradrenergic and serotonergic pathways in the brainstem. This would be helpful because these pathways can modulate pain transmission through the spinal cord. So there are a couple different indications of when pregabalin or Lyrica would be used, so I'll list off some of those here for you now. You can see it used to treat pain associated with diabetic peripheral neuropathy. It's indicated in the treatment of fibromyalgia. Some patients use this medication to treat neuropathic pain following a spinal cord injury. It can be used as an adjunct therapy when somebody's experiencing a partial seizure. And finally, it can also be used to treat post-herpetic neuralgia. Before somebody was to use pregabalin, there are some warnings and precautions that they should be made aware of. This medication is on the Beers criteria, which is a list of medications that the elderly population should avoid or use cautiously. In this situation, we would want to avoid giving this medications to individuals who have a history of falls or fractures. However, if the medication is being used to treat seizures or a mood disorder, some physicians may still choose to give it. If somebody is using pregabalin who also has class 3 or 4 congestive heart failure, they may put themselves at an increased risk of experiencing edema. If a patient is using thiazolidine dione medications and they also use Lyrica, they would be also at an increased risk of edema and they may experience some weight gain from this. Weight gain has also been reported in patients just using Lyrica. If somebody does experience angioedema while using this medication, typically we would want to stop the pregabalin. Hypersensitivity reactions have been reported with Lyrica, so this could be skin rash or hives. Some may experience redness or blisters, difficulty breathing, and even wheezing. If any of these symptoms were to occur, the medication should be stopped. Elevations in creatinine kinase may occur while patients are using Lyrica. This could become an issue for some patients as they may experience muscle pain or myopathy. Significant dizziness as well as somnolence has been reported. Some patients have also experienced vision-related events. So this could be reduced visual acuity or visual field changes, or even blurred vision. Suicidal ideation, behavioral issues, as well as worsening of depression have all been reported with pregabalin, and some of these situations have come up within the first week of therapy. Not recommended to use the extended release version in patients who have a creatinine clearance less than 30 mL per min, as well as those undergoing dialysis. Withdrawal symptoms have occurred when the medication was stopped abruptly. Rarely, but the worst case scenario here would be a seizure. More normally, we would see headache, nausea, insomnia, anxiety, sweating, and potentially diarrhea. Therefore, the dose of this medication should be decreased over time, at least 1 week upon discontinuation. Now, once somebody is made aware of the precautions and the warnings, and they start using pregabalin, they can expect to take it in tablet or capsule form. When somebody is prescribed this medication to treat diabetic peripheral neuropathy, they would typically use 50 milligrams of the immediate release formulation 3 times daily. This can then be increased over the next week to a max dose of 100 milligrams 3 times a day, so a max dose of 300 milligrams daily. If an individual is treating fibromyalgia, the dose may start off a little bit higher in this situation. They could start off with 75 milligrams taken twice daily, and then over the first week they could increase that dose to 150 milligrams twice daily. After tolerability and efficacy are established, some physicians will boost their patients up to 225 milligrams taken twice daily, so 450 milligrams a day. There isn't much evidence to support going over 450 milligrams daily of pregabalin to treat fibromyalgia. When treating post-herpetic neuralgia, 75 milligrams taken twice a day or 50 milligrams taken 3 times daily would be appropriate to start. Maintenance therapy in this situation could go anywhere from 75 to 150 milligrams twice a day, or 50 to 100 milligrams 3 times a day. This medication can be taken with or without a meal, and if somebody is using the extended release version, so the tablet, it should not be split, crushed, chewed, or altered in any way. As with all medications, there are some adverse reactions or side effects that patients may experience while using Lyrica or Pregabalin, so I'll list off some of those here for you now. So peripheral edema that we kind of mentioned throughout the video can happen anywhere from 3.8% of the time up to 12% of the time. 5% of patients notice an increase in appetite, and up to 12% of people notice weight gain. 4 to 8% of people can experience constipation. 3 to 5% may experience nausea. Ataxia can develop anywhere from 3% to 15% of the time. Dizziness is quite common. It happens anywhere from 17% all the way up to 32% of the time. Patients can experience a headache up to 7% of the time. Incoordination happens at a frequency of 2 to 10%. And somnolence is very common as well. This can happen anywhere from 11 to 35%. Tremors may also develop. This can happen 11% of the time. 2 to 8% of patients may notice a disturbance in the way they think. And 2 to 6% of people may experience euphoria. Nasopharyngitis develops in 8% of people using Lyrica. And a general sense of fatigue happens in about 4 to 11% of people. Jaundice may occur, as well as hypersensitivity reactions. We mentioned earlier that blurred vision may occur. This can happen at a rate of 10%. And then finally, suicidal thoughts as well as angioedema may occur. That's all we're going to talk about today with Pregabalin or Lyrica. As always, I'm thankful that you took the time to come by and watch one of my videos. If you're willing to help me grow this channel, you can do so by liking the videos, sharing the videos, or subscribing to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.